This year's theme is Break the Silence, Shine the Light on Sickle Cell Disease. This day is meant to highlight the struggles of living with sickle cell disease sufferers and their caregivers. Sickle cell is a genetic disease characterized by a mutation in the gene encoding hemoglobin within the red cells. And the result of this mutation is that the red cell loses its smooth circular shape and often assumes a crescent shape, which then results in the blockage of small blood vessels because it cannot move as smoothly as the round shape, so it ends up blocking small blood vessels and capillaries. As a result, individuals with this sickle cell disease often experience chronic debilitating pain, risks of recurrent infections, and other serious complications. Persons living with sickle cell disease are at a higher risk of getting infected with COVID-19 and more likely to get severe illness if they get infected. This is due to their impaired immunity resulting from their blood disorder. People living with sickle cell disease should therefore strictly observe the precautionary preventive measures for COVID-19. During this period of coronavirus pandemic, persons living with sickle cell disease are advised to ensure that they keep a minimum of 1 month supply of medication at all times. In addition, they should consult their healthcare providers should they experience COVID-19 symptoms. At least 240,000 children in Africa are born each year with sickle cell disease. Here in Kenya, it is estimated that 6,000 children are born with the disease. Sadly, between 50 to 80% of these children die before their 5th birthday. The recurrent pain and complications caused by the disease can interfere with many aspects of the patient's life, including education, employment, and psychosocial development. Interventions to control the disease include early diagnosis, provision of prompt and effective management, advocacy, communication and social mobilization for screening and genetic counseling, as well as during premarital courtship. I'm glad to note that the ministry, together with stakeholders, have developed guidelines for managing the disease, guidelines that will be rolled out very soon. This will help us improve the quality of care offered at our health facilities and community levels. I want to thank all stakeholders and partners who have supported the ministry to commemorate this day, particularly the Sickle Cell Federation of Kenya and Novartis. We are also grateful to the Public Health Club medical students at the University of Nairobi who have mobilized their colleagues to donate blood for the management of sickle disease, which is one of the ways of managing sickle disease also involves transfusion of blood when required. Fellow Kenyans, let me now move to the numbers for our COVID-19 over the past 24 hours. We have 117 people who have tested positive for coronavirus disease over the past 24 hours from a sample size of 3,043. The new positive cases pushes now our confirmed cases to 4,374. The total tests carried out so far are 133,541. Of these 117 positive cases being reported today, 112 are Kenyans and 5 are foreigners. The age ranges from 11 years to 75 years. 83 are males, 54 are females. In terms of distribution by county, these 117 are distributed as follows. Nairobi 51 cases, Mombasa 22, Kajiado 18, Kiambu 6, Nakuru 5, Garissa 5, Machakos 3, Kericho, Busia and Uasin Gishu 2 cases each, and Wajir 1 case. Below the counties at the sub-county level, we look at Nairobi. The 52 cases come from Kibra 8, Langata 8, Makadara 6, Dagoretti North 6, Kamkunji 4, Embakasi East 4, Embakasi North 3, Embakasi South 3, Mathare 2, Ruaraka 2, Embakasi Central 2, Embakasi West, Starehe and Kasarani 1 case each. Mombasa's 22 cases come from Mvita 8, Kisauni 5, Changamwe 4, Likoni 3, Jomvu and Nyali 1 case each. In Kajiado, the 18 cases recorded are from Loitoktok 12, Kajiado Central and Kajiado East 2 cases each, Kajiado North and Kajiado West 1 case each. In Kiambu, the 6 cases are from Thika 3, Kiambu Town, Limuru and Lari 1 case each. In Nakuru, all 5 cases reported are from Naivasha. And in Garissa, the 5 cases in Garissa are from Dadaab refugee camp. In Machakos, the 3 cases are from Athi River. In Kericho, the 2 cases are from Ainamoi, while in Busia, the 2 cases are from Teso North and Matayos. In Uasin Gishu, the 2 cases are from Kapseret and Soi, while the 1 case in Wajir is from Wajir West. I'm also pleased to inform you that we have discharged 91 patients from our various hospitals, bringing the total number of recoveries to 1,550. I want once again to thank our healthcare workers for the excellent work that they are doing out there. However, on a sad note, unfortunately, we have lost 2 patients to the disease, bringing the total fatality to 119. We send our deepest condolences to the family and friends of the departed. Finally, as you can see clearly from the numbers above, the spread of the virus is concentrated in some areas. Some areas, especially within the epicenters of these 2 large metropolitan urban and peri-urban areas of Nairobi and Mombasa. This could be attributed to change in behavior in some of these areas. For instance, we are aware that in certain parts of the city here, especially in some of the suburbs, such as Westlands, Lavington, Kileleshwa, and Hurlingham, we are seeing increasing number of young people congregating in groups and organizing gatherings such as house parties in some of these areas. We caution that this is recipe for disaster because that is when the virus is spread, when people get together and do not take the necessary measures and cautions that we have been preaching out here. This could well be some of the reasons why we begin to see increasing numbers in some of these areas. And again, we want to appeal to these young people and any others who may be flouting the rules, the regulations that have been put in place, not observing the containment measures, that we will stand the risk of igniting the spread of this virus in these regions. These activities are being conducted with little regard to social distancing requirement. I want to remind Kenyans that avoidance of social gatherings of any form, whether it is a religious or political or an entertainment gathering, is prohibited and is one of the measures of containment for coronavirus pandemic. I therefore want to appeal to our people to take individual responsibility in observing the measures that have been advocated by the ministry, and failure to which we will only see escalation of the number of infected within the country. I thank you all.
Thank you very much, Tan. It's your chance now to ask a question of members of the press. Get the chance to get the name the media have then. Yes.
Thank you very much. My name is Emmanuel To from KTN News. Just one question. Some weeks ago, the government had a problem tracing people who had given wrong contacts, and the contact tracing was a problem. What is the progress up to this point? Have you got those people yet? Thank you.
My name is Stephen Leto from Citizen TV. I have two questions. There seems to be an increase in numbers every day. My question is, has the ministry tabulated in terms of the infections that come at the border and the local transmission? Of the 117 cases that, for instance, you've reported today, how much are from the border points and how much are within the community transmission? My other question is, a few days ago we had 4 cases in State House, Nairobi, confirming positive to COVID-19. How far is the contact tracing inside State House, and what plans does the ministry have in terms of securing State House to be free of COVID? Thank you.
My name is Nancy Okware from KBC. Yesterday we had tested over 6,000 samples, and today we have tested slightly over 3,000 samples. So what can be attributed to the decline in the samples tested today? And finally, what are the nationalities of the foreigners who have tested positive for coronavirus?
Naitwa Boni kutoka NTV. Jana kumekuwa na tetesi na dukuduku, kumekuwa na visa vingine vya corona Ikulu ya Rais. Sijui kama unaweza confirm.
Okay. One more.
My name is Anita Nkonge from NTV. We're continuing to see politicians as well as young people flouting these measures that you're putting in. What are you doing about this?
Let me start with the last question. Of course, we do not condone any flouting of the rules and regulations, measures that have been put in place to protect Kenyans. And one of those measures, of course, is to prohibit any form of public gatherings that are going to lead to spread of the virus. Indeed, yes, we do see now and then, time to time, situations where we feel that those rules have not been followed by different groups of people. And we want to reiterate again that it's not acceptable. Of course, there could be repercussions. Then certain actions could be taken if these things continue and people do not pay any heed to the measures that have been put in place. In time, I think this will exhibit itself in some form or the other. The message that we want to send out here is that it is not back to normal. We are nowhere near normal, and we should not behave in a manner that we think we are normal and we have beaten the virus. We can come back to our old ways because we are still seeing increasing numbers of COVID cases. We are likely to see a rise in the coming days, and we need to be very vigilant, and we need to exercise and be responsible as individuals in protecting ourselves and protecting others by adhering to the measures that have been spelled out before. Hiyo swala ya Ikulu na kesi za Ikulu kule, mimi hapa mwenyewe sina habari hizo wala sina hizo numbers, lakini wakati huyu mwenzangu daktari akiingia, labda yanaweza kuangalia kama anaweza kujibu hiyo swala. Okay? Nancy Okwaro, you noted that there is a decline in the number of testing cases from 6,000 yesterday to 3,024 today. I mentioned to you yesterday that the large number we tested was a concerted effort to try to clear up a backlog that we had. And that is why we had that large number. You must understand too that when we do large numbers of testing in the lab, it also stretches our capabilities because we have only a certain number of equipment and human resources that can do these tests. In fact, doing 6,000 in 24 hours is quite a feat. So as I said, that was a concerted effort to try to cut down on the backlog. We are now coming back to around what we normally do over a 24-hour period, which is anything between 2,000 and 3,000, and that is why you see the drop. The numbers are also related to the availability of the kits and the number of kits that we have. As we push through these kits, knowing very well that the supply chains are uncertain, we also have a plan on how we want to use them, how long they will take us. So all of these factors do determine the number of samples that we can test within a 24-hour period. But generally, I think the level that we have been testing over the last several weeks has been between 2,000 to 3,000, somewhere in between, over a 24-hour period. Emmanuel, KTN, yours was to find out from us what progress we have made in contacting those individuals who were identified as contacts of positives, but who had given us wrong information that we could not contact them. Again, I will allow the DG to respond to that question because he may have that information on hand. Okay, we have Stephen Latoy. You wanted to hear more about the cases, the breakdown of the cases, those at the border and those internally. We generally do actually state in our breakdowns when we have cases at the points of entry. Generally, if we are seeing people in places like Kajiado and Namanga or Busia, those are truck drivers. But remember, some of these truck drivers are actually our own truck drivers who are planning to move out. So it's only mainly from Tanzania that we see drivers coming in. some numbers there of positive cases. But by and large now, what we have is a community transmission, which means this is transmission within the country. And really, it actually makes no difference now whether it is an importation or whether it is an internal transmission, because the spread is now well rooted in the community. I talked about your other question was about State House, and I think I have said that maybe Dr. Amoth can respond to that. I think those were the questions that were directed at me. So, Dr. Amoth, maybe I can hand over to you.
Thank you.
You might also want to perhaps just elaborate on the deaths that two deaths we have recorded today in terms of some more details.
Thank you, Waziri. Indeed, today we have reported 2 deaths. Both deaths occurred at the level. So one death was a 5-year-old young man who died in the Dadaab refugee camp with no underlying comorbidity. The other death occurred in Thika, 46-year-old female who had diabetes. And from our previous releases, you know very well that diabetes is the most risk factor associated with COVID-19 deaths in our setup. Number 2 is diabetes together with hypertension. Then number 3 is hypertension. Then the other coexisting conditions like cancer, HIV follow. So this is just to warn the young people that they are not immune, one, from contracting COVID, and in the unfortunate case that you get a serious form of COVID-19 disease, that if you are young, you are not immune to death. We know now the Premier League again has resumed, though in empty stadia. Kenyans love football and soccer, and my appeal to the young people is that even if you are to watch the game, please ensure that you have your mask on and you maintain the physical distancing so that you don't put yourself at risk. Deaths now we are seeing, even yesterday we reported a case of a death without any underlying medical condition. So as the numbers increase significantly, we'll have more deaths, and these deaths now will not apply only to the high-risk group, but will stretch the entire age cohort. In terms of the people we had who had given us wrong contacts, again, remember we are working through the multi-agency team. And further now, when we are taking the details, we take the details of your passport number or ID number to ensure that we can be able to go back to our data to be able to find out where you are. Out of the initial 140, a few number from that group were also people from outside Kenya. And people gave various reasons, of course, once we caught up with them for giving wrong information. Remember that happened especially when we were doing the targeted testing in Isili. And because of the large community of refugees in Isili, some of them were fearing disclosing their real contacts because then the security forces would be able to catch up with them. But all these 140 people have now been removed from our contact list after follow-up and after finishing the 10 plus 3 days without the symptoms. For contact tracing in State House like any other part of the country, of course, we do testing routinely, and if we get cases, we have had the support of officials of State House to ensure that we do contact tracing. And the number that was reported was from a very, very huge sample. And I want to commend State House staff for routinely testing after every 2 or 3 weeks all the staff within their premises. So contact tracing in State House, just like any other place, continues as usual. And we are getting total cooperation from our colleagues at State House. The nationalities of foreigners in the spirit of regional cooperation and integration, we have received an advisory from Ministry of Foreign Affairs that our neighboring countries are reluctant that we don't disclose the nationality of any person from their countries who is tested within the territory of Kenya. and in the spirit of good neighborliness, we shall respect that. I think that is what came my way for today. Thank you.
Thank you.